I'm Dr. Marcia Sonity,
And I'm Dr. Caleb Moore,
and this is
the Free Smiles Podcast.
Today we're talking about, I would say, sleep apnea, but I also want to throw out the term sleep disordered breathing.
Okay. Well, before we dive in, I want to say I am personally a victim of this.
I know, I used to be your roommate. I'm very aware of
I know. I'm like, I need to see an ENT immediately. Like, I have deviated septum. I need to get my tonsils and adenoids out. Like, I have tongue tie. I have all the things. So
Yeah.
we're going to dive into all of that.
Have you done a CPCT on yourself?
I have. I need to share it with you, and
Yeah,
we'll
you
review
should.
it together.
Yeah, we should. We should do like a whole
Yeah.
reveal of your. And I'll show you my airway. It's huge. I have a huge airway.
Okay, well, let's
I
not
breathe
flex.
like a champion. That's the only thing I can flex on. I don't have a lot over my husband, but my breathing and airway is like the one thing I'm better at. So I'll take my wins.
Well, let's start with, when you see patients in office, what are you looking for, and how do you have this conversation with them about airway?
So the first thing, and I'm trying to implement a little bit more of a more fully enveloped way of doing this in my office. But what I look at, so I actually incorporated into my like oral cancer, oral tissue screening.
Mm-hmm.
So what I want to know from a patient is, I want to know what their medical history is. Like, do you have a history of high blood pressure? Have you had a sleep study? Have you had any of the stuff in your past that you're aware of? And then as I'm looking at things, so when I'm looking at the oral cavity, the first thing I'm looking at is what is the, team, like your joints. Are there any clicking, popping in your joints? I'm looking for joint dysfunction. I'm looking for any deviations in that. I'm looking for any tenderness, swollenness, anything like that on the outside. Mm-hmm. So as I'm going on the inside, I'm looking at, so let's talk about tissues. So a lot of times someone's a mouth breather, which we'll get into. So I'm looking for signs of mouth breathing. A lot of times someone who has a high palate. So a high palatal vault mixed with red tissues that aren't really associated with a lot of plaque buildup. And then signs of bruxism or a misdiagnosis of bruxism in their past or having wear on their teeth in general. So I'm usually asking patients, if I'm seeing these things, hey, how is your sleep? My general question is, do you feel like you wake up feeling rested? Do you wake up a couple times during the night for any reason? And do you dream? Those are three key questions that can actually get you to figure out if you're having some kind of sleep disordered breathing in your own life. So then why those questions are important. So if you're waking up frequently throughout the night, that could be a sign that, so if you're waking up to go to the bathroom frequently, that's a huge one that why people would be getting up. Obviously, if you have like a kid or a 2-year-old, that's a lot of the times I'm talking to a parent, they're like, well, my 2-year-old gets up out of bed sometimes and just up to me. I'm like, okay, well, before you had children 2 years ago, what was your sleep like? So if they're telling me, like I get up like 2-3 times a night to use the bathroom, that means that your body is, so when you are in deep sleep, not in REM sleep, but the deep sleep cycle, your body's actually producing antidiuretic hormone. If you're not in deep sleep, your body is unable to produce that. So then you're producing urine throughout your sleep cycle, and you're actually, that's what's waking up at night, is that part of it. So that's why that question is important. The next question that I ask them is about dreaming. It goes along with that same thought process. If you're not getting into deep sleep, you might not be getting into REM sleep, or your REM sleep is being disrupted because your body's trying to wake you up. So why are these manifestations in your oral cavity? Is because when you are laying back, if you don't have the proper tongue position or the tongue strength and posture, your tongue's going to fall back into the back of your mouth. If you can't breathe through your nose properly, you're going to try to mouth breathe to open up your airway, and your lower jaw is going to try to posture forward. That's why the bruxism part of it is a part of that assessment as well. So the misdiagnosis of bruxism, you might be bruxing, but it's actually because of something else. The root cause is different.
It's very interesting. One thing that I'm actually doing in my practice is using, this is just a little, tip for dentists out there, is the cotton roll.
Mm-hmm. Yes, that's a great one. Yes.
Yeah, so use the cotton roll, and you can check in between their maxillary first molars what that intermolar space is, and evaluate, how high their palate is, right? And if they have enough space, intermolar space to, because, if they have that higher palatal vault, then they're more likely to have sleep apnea. It's been correlated. Another thing that you mentioned, like just checking out the tissues in general, and tongue position, that's a huge thing.
Tongue tie is another one. I guess I should bring that into the equation as well. Yeah. I'm trying to get through, it's funny when you're in practice and you're going through things, you don't think about it, but when you're trying to talk about it later, you're like, Oh yeah, what do I do?
What do I do?
Yeah.
Yeah.
But I look at that as well.
So
Yeah.
yeah, you look at the tongue tie. You're also checking like their malum patty,
Yep.
which is when they're sitting up and they're saying can we see back there,
Mhm.
right? What can we see? Can we see your uvula? Can we see your posterior pharyngeal wall, or is it all blocked, right?
Yep.
Is your tongue like a cobra?
Big old tongue.
Right.
Yeah.
So, and then another thing with that too, that you mentioned is like the scalloping of the tongue, right?
Scalping and tongue is a big part of it as well. Yeah.
Yeah. Like,
Mhm.
are they trying to, I think of it as like this tongue that's like an animal trying to break free from a cage, right?
Well, kind of it. I mean, yeah, and it's essentially your brain trying to break free from having too much carbon monoxide,
Right.
essentially, in your body. Like you're not breathing properly. So, yeah.
Yeah. And so, screening patients, I think what you're doing in practice is so beneficial because a lot of people, even my hygienist, like she's having these conversations more often now about tongue ties and, how are you sleeping? And, 60-year-old men will be like, no one's ever mentioned to me that my tongue is
Oh,
tied.
I think so this is the statistic. So I think it's 25% of women and 45% of men are in the category of sleep disordered breathing. So
Hmm.
what sleep disordered breathing is, it's the essentially think about it like, okay, the end disease, let's say it's high blood pressure.
Yep.
But there's several stages before you have like full blown like stage 4 hypertension. Say you're at like hypertension type 1 or pre-hypertension, what
Yep.
they call, like you have a little bit of an elevation here and here in your blood pressure reading. That's what sleep disorder breathing is. It's a warning sign. It's something that we can treat early and actually prevent you from literally losing air when you're sleeping, which is causing a downstream of systemic effects, high blood pressure, premature death, like all these
Yep.
things are like brain issues, misdiagnosed ADHD in children, misdiagnosed ADHD in adults then.
Yeah.
Like there's so many slews of issues that stem from sleep being the main pillar of our health that aren't being screened because really as dentists, I don't think we were educated properly about this.
No.
And I had to go through so many courses just over time, like over being a hygienist and then now doing different, really just trying to find how to treat the root cause of things versus, hey, let's just put someone in a mandibular advancement device,
Right.
which has its downsides as
Negative
well.
side effects
Yeah,
as
everything,
well.
there's pros and cons.
Yeah.
Yeah, for
And
sure.
I think one thing that you mentioned was, children, right? I
Hmm.
mean, we are seeing children more than they see their pediatricians.
Yep.
We're watching them develop,
Yep.
right? And when we talk about the development of their jaw, and you've touched on this, like the modern diet has changed, which
Hmm.
has then changed the way our jaw and our face is developing now, right?
Yep.
So we need, we have a responsibility to be like first responders, to
Hmm.
this issue,
Yeah.
right? As one thing that I do in practice is if I have a child in my chair who may have signs of bruxism, or I can tell that maybe they're going to have developmental issues
Yeah.
in that sense, or airway issues,
Yeah. They have bags under their eyes. They're
yeah,
not sleeping well. They're wetting the bed, into a later age in life. All these are signs that your kid isn't having the proper airway development or the proper tongue posturing development or breathing development.
exactly. So I have them sit there and I'm like, okay, put your lips together for me
Hmm.
and try to breathe, just breathe for me. Keep your lips together for 30 seconds. Don't open your lips.
Hmm.
Let's play a game, right? And if you see their chest start to really struggle, right? And they're wanting to separate their lips or they open just a little bit, then we know that they're mouth breathing and they're not nasal breathing. So then we need to, either treat that in office if we can, like if you have a myofunctional therapist, or send them out to their ENT to have an evaluation, which is what I typically do.
Yeah.
But I want to transition a little bit into when we talk about mouth breathing versus nasal breathing, what is the difference and what are the benefits and risks of either?
Yeah. So, and I mean, I should say I'm even like a novice on understanding this because I think we're all novices on understanding the human
Yeah.
body. But my understanding of it is we are our bodies are developed to breathe through our nose.
Hmm.
So if you are someone who is mouth breathing when you were a child, let's say as you're developing, so it's likely if you're developing as a mouth breather, you might have not been. There's a whole link with like breastfeeding and bottle feeding and palatal arch form and tongue development as well.
Interesting.
Because when you are breastfed, your tongue has a certain kind of posturing and it has to do a certain kind of action to actually get it to the roof of the mouth to get the the
Right.
the feeding process to happen. when you were bottle fed, you don't have the same kind of like suckling habit. So you don't have to posture your tongue up and high, which is why we get more narrow arches on the upper, which would then lead to you not having the proper tongue posture growing out of that. And then as your palate develops more narrow, you don't have the room to put your tongue up there, so your tongue's gonna develop more forward.
Yeah.
You'll develop a tongue thrust habit. That's a huge part of it as well in a lot of people. So open bites, or a lot of those things are from that. Obviously, if you are like a thumb sucker, that can lead to more of an open bite as well. There's a couple different things. So when you are, going through development, if you're more of a mouth breather, you develop as a mouth breather, that's also going to, relate to there's so many muscles that relate to your tongue, but the genioglossus is a huge one of those. That's posturing your tongue up and forward. So if that's underdeveloped as a kid, then it's going to be underdeveloped as an adult. So as you go to sleep at night, your tongue's going to fall backwards. It's going to close your airway off more. You're going to more in your sleep. You're not going to get that proper breath. So not only is it proper breathing and the right amount of breathing, because a lot of times we're actually breathing too quickly now as we're finding more out about our breathing habits, but as we're supposed to be developing with our nose, there's humidification that happens through your nose. There's filtering that happens through your nose. There's a whole nitric oxide pathway that I don't actually understand completely, right, but it's a huge part of a lot of the pathways in our body and our physiology. So if we're not breathing through our nose, then that's also going to be a downstream effect for your systemic health.
So to simplify it, like mouth breathing.
I was like, please try to simplify
no,
it.
I'm
I've
just
been
saying,
trying.
No, it's like mouth breathing is basically you're getting dry air that's not doing anything for your body, right? It's really not, right, if you think about drinking, water that's really good for you versus like a soda, right? It's like you're getting the soda, you're not getting the water that's actually hydrating you.
Right.
Right. So the nasal breathing is superior in many ways. And yeah, I think, it's crazy to think about, I've been mouth breathing for years. I am like the prime candidate for all of this, and I know it. But it's like, what do we do about it? What do I do about it? If I were to go to my dentist and they tell me, hey, you're mouth breathing a lot, it's like, where do I go?
Well, that's the whole thing. And that's why, I think it's interesting, like in my practice as a holistic office, they weren't doing a lot of airway things. So that was something that I was personally really interested in learning more about. I really just wanted to dive into that. I wanted to dive into the root cause. Like, what is it? Treating kids, I think, is a huge part of that, and just acknowledging that, talking with parents. A lot of my patients come in and they ask me that about their kids, which I think is great. But I think the general population isn't as informed about that.
Yep.
So obviously going to a holistic office, most of the time we're more airway focused and developmental focused. But what I am now trained on is a device called the HomeoBlock. So what the HomeoBlock is it's a palatal appliance. It's for adults or people that have their premolars and adult molars in, because it has to rest there. It is a device that's actually, there's a uniblock to it. So there's one side that's actually sitting on like one side of your occlusion. We assess which side of your body is least developed. So everyone has, we call like a chirality or a balancing. So if you look at someone's profile, they're going to have one side that's more developed than the other. There's actually a program you can run someone's profile to do this, and it's free. So we're going to do that. We're going to do an airway assessment. We're going to look at a CBCT or a 3D x-ray that's going to go all the way around your head. Show me your airway. Do you have a really, like what they call like a fire hose airway, meaning that your airway is like cinched like this? Do you have a really broad open airway? It's not always related to neck size, which is why I think it's interesting. But that's part of it. There's 6 assessments that I do, so I'm trying to go through them quickly. So those are the main ones. And then talking about the HomeoBlock therapy, you're usually in that device for about 9 to 18 months. So what it does is actually adds stimulation to the posterior, anterior palate, kind of a little bit of both, but mostly posterior palate. It's not technically an expansion device, but it actually is supposed to be stimulating the 4 bones. So I think it's the temporalis, the sphenoid, the palatal, and one other bone I can't think of at the moment. But it's stimulating them to actually create growth and expansion, but coming from the bones, not just moving the teeth.
Yeah.
So it's stimulating also the PDL, and there's a certain calculated depth where your the device sits between. There's a little space between it and your palate that actually creates a help when you're going through, because you go through myofunctional therapy as well when you're using
Right.
this device to create a tongue upward and backward posture when you're swallowing, but you wear it when you're sleeping.
Yeah,
So
and
that's a nice part
what's
of
the
it.
goal? So when they finish that
Yeah.
treatment, what are we looking for?
So the goal of it is to downregulate the ANS, to downregulate your vagus nerve, which is
Mhm.
innervated with the palatal area,
Yep.
and to do some expansion into your palate. And usually we're doing some kind of orthodontic expansion after that. So it's usually coupled with that. The more and more people that have been doing it, and the more we've had this device, we've learned that we need to do some kind of orthodontics afterwards because most people need it anyways. We
Yep.
just want to do this first. But the goal is just to, work with it's a multifactorial. So it's working with a myofunctional therapist. It's working with a postural, either a chiropractor or someone who's able to assess kind of your forward head posture. Because a lot of people with these issues actually tend to bring their head forward and have
Mhm.
that forward head posture because they're trying to open up their airway.
Yeah.
Because when they're back like this, it's getting closed off. So
Yeah.
it's working with an ENT. Do we need to reduce adenoids? It's so complex, which is why I think it's just so, I mean, fun in a way to learn about because it's not just, hey, we're just going to put you in this mandibular advancement device, which I think is still a great option for people. But to me, if I'm just putting your jaw forward at night, there's going to be downward effects of that for your
Mhm.
joint. There's going to be downward effects for your bite.
Yep.
It's not really fixing the root cause of like how you're breathing and where the rest of your muscle tone is. So this
Yeah.
is actually a almost like an all-encompassing thing to treat that root
The
cause.
root cause,
Yeah.
because like with an MMA or a mandibular advancement device, it when you during the day, what's happening, right?
Right.
So it's moving it forward
Well, yeah, how
at
are you
night.
breathing during the day? Yeah.
Exactly. So
Yeah.
you're trying to train this jaw essentially, but that's not happening. It's going back to its position.
Yep.
How are you breathing throughout the day? You're going to be mouth breathing throughout the day,
Mhm.
right? And I think one other thing that you said earlier about tongue position. Correct me if I'm wrong, but your tongue is supposed to be. You're supposed to have your tongue up on your palate, right?
Yep.
It's supposed to be up high.
Yep. All the time.
And even for me, like when I go to try to and I'm trying it right now for people
Mhm.
who are listening on the podcast, right? But when I try to put my tongue to the roof of my mouth, I can only touch with the tip of the tongue.
Yeah.
But it should be, the whole
Hmm.
tongue.
Yeah. And when you swallow, you should be putting even more of your tongue up there. You shouldn't be thrusting your tongue forward. And that's one thing. I mean, I didn't know how my breathing was until I started learning about this. So I like during the day, I'll notice, like, I'll try to like be like, oh, where's my tongue at? And my tongue's always to the roof of my mouth.
Hmm.
Thank God.
Right.
That's the one thing I have going for me is that my tongue's up there.
Yeah.
So,
Well, mine is not. And another thing that you highlighted was the myofunctional therapy of that. For people who don't know what that is, it's basically, training your muscles,
yeah,
right, to operate.
it's PT for your tongue.
Exactly. That's
Yeah.
a very simplified way to put it is like it's PT for your tongue because when you're going through these devices or, this treatment, you basically, we should release that tongue, right? You can't just release a tongue or like earlier when I said it's like letting an animal out of a cage, right? If it has no direction,
Right.
it's not going to know where it needs to go now, right? If I've lived 28 years with my tongue restrained or at a certain position, when we set it free, it needs to go through PT
Exactly.
to train it, right?
Yeah, and that's a good point because actually, like, I never understood where the myofunctional therapy came in. Like, is it before, or is it after? Especially with a tongue tie release. Like, if
Mm-hmm.
we're doing a tongue tie release, you actually should be doing myofunctional therapy before that.
Yep.
Because again, once you're releasing that tongue, it's not going to know what to do, so it's going to be falling back more often. So we should actually be doing almost like pre-surgery training, releasing the tongue, and then doing post-surgery training as
Exactly.
well. Yeah.
Yeah. And then, like we talked about earlier, this affects people of all ages. Um, but, if we are that early intervention, right, we are noticing these signs in office. Are you offering like a take home sleep study? What is that, and what are the benefits of it?
Yeah, so the one that I just learned about, which I'm just getting started in my office because I would just refer with like a sleep clinic, go to you, through your medical insurance to do it. But now I'm using sleep images. It's actually manufactured in Colorado, which is
Hmm.
nice. But it's a finger test. It just tests a couple different things. It's pretty all inclusive for like it's a ring that you would wear. I know some patients have like an Aura ring or a
Yeah.
Whoop band or an Apple Watch that monitors certain things. This one is actually FDA approved for sleep
Yeah.
evaluation, so it does a bunch of different things. but that's the one that I will be using moving forward.
Yeah.
And I believe you have one as well that you like to use.
Yeah. There's multiple ways to do sleep studies. We can have them attaching to your face, right? We can have a pulse ox on your finger. So we're testing, what percentage of air you're getting, right? If you're having the apneas, how long are they? We get all of this data, and then we use that as a baseline. So when we think about, in dentistry, we think like, okay, well, for me, for a while it was, well, we really need to make sure your foundation is great before we move forward. And that was with perio, right? We need to make sure your periodontal health is under control so we can fix your teeth and make sure they last a long time.
Yep.
Well, the other, component of that is the airway, right? We need to ensure that this needs to be a baseline, right? We need to, you know, check your airway. If you want to do a take-home sleep study, the benefits of that is you can take it home today and sleep in your own bed.
Yeah.
I'll give you some instructions. You can have a normal night's rest in your own bed, relatively, you have things attached to you, but and then that's going to give us more accurate data on how you're sleeping and what are your habits like at night. Because if I'm doing an FMR or, full mouth, rehabilitation for somebody, I'm not going to do that if you're going to chip and break away all of the work that we just did.
Well, that's the thing is like, again, we're setting up the foundation for long-term success. Our goal is to have less dentistry and to do and make you a healthier person for a lifetime. I'm not here to continuously keep fixing your front tooth from chipping.
Oh, yeah.
The investment of just fixing that front tooth 4 times is going to pay for the device that I'm going to be caught, like fixing the root cause of possibly that issue that you're having. And the other thing you said about the take-home sleep study, which I think is almost, I mean, it's obviously they go towards like the gold standard, like what is the gold standard for this? And I think a lot of people and people that I know and patients of mine that have gone through these sleep studies is if you're going in somewhere, it's usually one day that they end up going. We at least want 2 days of data because if you are only going into the hospital for one night to do a sleep study, you're not in the right, it's not your bed. Things are weird. We will get some data if you're having apneas, like you can't deny that from happening. But how's the rest of your sleep going? Like, is there other disruptions in that? Which wouldn't give you to a apnea level, but you're doing that like sleep disordered breathing and losing oxygen even a little bit. Like even if you're losing oxygen for 30 seconds in your sleep cycle, try holding your breath for 30 seconds every hour. That's a great test. Is just like whatever your sleep study is, try to hold your breath for that amount of time just by sitting here. I bet you can't do it.
And to your point with that, any disorder, like there are, there's different I guess different baselines for sleep, right? Or how we sleep. And a lot of people go off the 4-stage model. So there's 4 stages, different types of sleep when you go to bed, right? And if you're not getting to certain levels of sleep, your body is not able to heal itself, right? One of the benefits of good quality sleep is our body to just relax, right, and heal itself.
Yeah.
And if you're not getting to that stage, then you're just constantly in this fight or flight mode.
Well, that's
right?
the whole thing of it is like, especially I think with women, it's almost misdiagnosed more because we're used to just being these like, we can do it all, we can put all this stuff in, we're just constantly adding things to our plate and whatever it may be. And the prevalence of that, like our cortisol levels are different than men's, like the spiking of that. I mean, you can go into the studies of like women, how we have to train differently when it comes to weightlifting. We need to be if we're doing cold plunging, we need to have different temperatures just because our cortisol levels fluctuate because we have different hormone changes. We also go through premenopause, we go through menopause, we go through postmenopause. All these things are going to affect our sleep differently. And if we're not diagnosing or getting into the root cause of the other issues in our sleep patterns, that's just like, we just think it's normal. We just think that the way we feel is normal because our hormones just suck our entire lives. Yeah.
But it's not normal, right?
No.
And there are ways that we can fix it.
Yeah.
And so kudos to you for what you're doing in your practice. I think it's really beneficial. And a lot of people don't have the knowledge about it. So
well, I agree. And I think just the more we talk about it, the more we know. I mean, I think this is a lifelong just learning effort. I think in dentistry in general, like it's not like we're at the end of the line of knowing what we should know about this, but
Never.
I think we know so much more even today than we did 5 years ago. I mean, I didn't even know what the homeo block was last year.
Yeah.
Until I went to a homeopathic conference There was a guy there that's been doing it for years, went through all the history of all that stuff. He went through all the airway training through Vivos, through the mandibular advancement devices.
Mm-hmm.
And then finally it was like, no, this is the device that I'm using in my practice, and I will never do anything else. And I'm like, I want to do what that guy's doing. I
Right.
want to treat the root cause of it. I just don't want to put someone in like these other devices without really knowing or knowing more about the consequences of it and not knowing all the consequences of them.
Yep.
Yeah.
It's all about risk assessment
Mhm.
and knowing, you know, we need to see outcomes, right? And know that when we're treating a patient, we give them all the options. They choose, what they think is best for their
Mhm.
body, right? And we guide them in that.
Yeah.
But like you said, just having a one size fits all, like if you're misdiagnosed with bruxism or someone tells you you need a night guard.
Well, there's statistics on that as well, if we can just drop that in
Yeah.
really quick.
Yeah.
So, through my Koi's training, there is the statistic and the meta-analysis that he does, which is phenomenal, is stating that it's 80% of the population. So if you're diagnosed with bruxism, 80% of those people are misdiagnosed. They have
Mm,
other TMJ or malocclusion issues. There's 10% of those people who are either having sleep apneas or sleep problems. They're neurological things,
yep.
and the other 10% of the patients are just normal patients. So I would say probably 90% of the population that's in a night guard probably doesn't
Need to be
need to
one.
be in that night guard, and they should be having other therapies. But that's just you're the product of where your education is, and I
Hmm.
think me and you should give ourselves kudos for wanting to put our money into that continued education and learning more, because a lot of doctors aren't doing that.
Yeah.
Yeah.
Well, and thank you for being open to sharing this with, doctors who are listening because
Yeah.
this information that we've shared today is so valuable. And just implementing this into practice, encourage your patients to get sleep studies.
Yeah.
Make that part of your standard of care, and you will realize that you're going to have more success in your career.
Well, even if you don't know it, like you don't have to know everything to assess for it. I mean,
Yeah.
you just know the basics. Like, asking patients those few simple questions about things. There's a really good book that it's called Breath, if any doctor or layperson wants to read. It's actually wrote by a journalist who went through a whole uh, list of different things to kind of solve his own breathing issues.
Hmm.
And that one of the DDS that he worked with, Dr. Belfort, was actually the creator of the Homeo Block. So he has a whole book about breathing, how important breathing is. I'm actually reading that. I read it, I think, a long time ago. I'm rereading it now, just seeing a different perspective on the whole thing. But that's a really good book if anyone wants to just get a little more information.
Yeah.
Yeah.
Well, thanks everyone for listening. We will see you back next week.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.